Welcome back to the ACS Brief from the Frontline Surgeons' Voices. With me today is Lillian Cow. Dr. Cow is Professor of Surgery and Chief of the Division of Acute Care Surgery, as well as Vice Chair for Quality at University of Texas Health in Houston. In addition, Dr. Cow is the Pillar Lead for the Board of Governors Quality Pillar. Welcome, Dr. Cow.
Thank you for having me.
Thanks for being here, and thanks for all the work that you do for this very important Board of Governors pillar. Perhaps you could tell us, for those folks who are listening and watching who don't know, what are some of the quality initiatives of the college which roll up under the pillar?
Sure, absolutely. I think the important things are that the quality programs have really built on a very strong foundation that started with the National Surgical Quality Improvement Program, or NSQIP, and all the accompanying clinical registries that really provide us with robust data upon which to drive quality improvement. So to add to that, the Quality Verification Program provides 12 standards for institutions looking to be leaders in quality and safety. Our hospital went through a quality verification program, and I'm a site reviewer for the program, so I can say firsthand that being part of the program is a really valuable experience in terms of learning what your strengths and opportunities for improvement are. So the QVP, or Quality Verification Program, has recently launched officially, moving past the pilot program stage. Additionally, while the QVP provides infrastructure and NSQIP provides data, we've tried to add on a how-to program. So the quality improvement course, it's really a basic course, is currently available online, and it has 6 modules which go through everything from processes of how do you start, how do you do a quality improvement project, to some of the barriers that are common around teamwork, leadership, context, etc. Additionally, at the quality and safety course, we're going to offer an in-person one-day workshop for people who are interested. They will also have access to the online course. So I think we're really building the quality programs in a stepwise fashion in the college.
There are a lot of other quality programs out there that are within cancer and bariatrics and trauma, as well as the more global ones you've mentioned. And indeed, we were honored to also be a pilot site at Cleveland Clinic, Florida. Drs. Coe and Hoyt were our reviewers. And it was quite an excellent educational opportunity. But what are some of the other programs that are more perhaps specialty or discipline specific?
Yeah, the hope is that the QI Basics course will have advanced modules that will be specialty specific. So for example, we've worked with Dr. Wick and the colorectal or the rectal group to try to come up with an advanced module for that. And then I think we'll work with Avery Nathans and trauma and other groups to really add on to provide more subspecialty specific guidance. So the QI Basics course is really just the beginning.
Great. And who would benefit from the course? Surgeons in practice in the US? Is it also something that's valuable for international surgeons, for surgeons in training, residents and fellows?
Yeah, I think all of those, even non-surgeons who are involved in surgical quality improvement. We really tried to make it as basic as possible and as generic as possible. So in fact, we use a 10-step quality improvement process that could translate to PDSA cycles or DMAIC or any other stepwise process. So we really tried to keep it really applicable to everyone. And again, it was just our first iteration, so we're very open to feedback on how to improve. We hope one day to provide a longitudinal experience, which we're actually piloting with the military, where we would provide the contents of the course, but also have an experiential component where we would facilitate a QI project in real time over several months.
Interesting. And it's also, I think, easier to follow as the programs have been standardized, the process and performance metrics and the way the manuals are organized seem much easier to follow now than in the past, given the standardization amongst programs. So now that we have that chassis, that framework of standardization, what's on the horizon? What are some of the new things that the pillar is going to do under your leadership?
Sure. So just to so everyone's on the same page, my pillar includes 4 work groups: best practices, physician competency in health, surgical care delivery, and telehealth. And so one thing we'd really like to do is to align some of the activities of the work groups with those of the of DROPC and the Division for Patient Safety and Optimal Patient Care, so that, for example, the telehealth group is coming up with a white paper on sort of best practices for telehealth. And perhaps one day telehealth standards might be part of the Red Book, which is the book that guides the quality verification program. Additionally, the Physician Competency and Health Workgroup is tackling the challenging topic of what to do with the aging surgeon. This is not a very simple feat, but perhaps those best practices can also be incorporated into the standard. So trying to think about how some of these projects might align with the programs that already exist with the college. Additionally, there is so much literature out there. The best practices work group is really looking to try to cull through all that literature, use the expertise within the college, and come up with the 3 best articles per year in each topic area to help guide practitioners who don't have time perhaps to read all these articles. And then I don't want to leave out the surgical care delivery work group. Certainly the pandemic has provided challenges to the workforce. And so looking at what data the college might have in terms of have a lot of surgeons retired, dropped out of practice, and what is the future? And all of these, again, relate to providing care. Obviously, if we don't have enough workforce, or whether they age out, whether they leave practice for other reasons, whether they're just overwhelmed by electronic health records, all the number of things that challenge physicians these days. These are all important in terms of ensuring quality.
You've certainly covered a lot of ground. Is there anything else you'd like to share with us?
Absolutely. I don't want to leave out the important work done by 3 of the committees that are under the quality pillar. There's the Committee on Perioperative Care, Commission on Cancer, and Committee on Trauma. And many of you may know that the Commission on Cancer and the Committee on Trauma just celebrated their 100th anniversaries. And both programs have a very robust history in terms of moving the needle forward in surgical quality.
Sounds like you've incorporated the gamut of things that are germane to our practices at this point in time, and you've got a lot on your plate. I'm sure you're going to handle it in a very capable, laudatory manner, I've no doubt. Thank you very much for your time today and for all that you do for our patients through the quality pillar.
Thank you.